Hello visionaries, it is so good to have you join us. On this channel, we are building the gaps that exist in our many health systems. We aim to empower, strengthen, and provide resources to health administrators so that in their communities they can expand access to care, reduce health disparities, and create healthier and more resilient communities. We know this is not easy, and that is our reason for supporting you on this journey. Community-based health organizations play a vital role in providing essential care to underserved populations. However, reduced funding is threatening their ability to deliver these critical services. Today, we will explore the challenges that these organizations face. In another video, we will dive into practical strategies that can be used to overcome these persistent funding threats. If you're a health administrator or program leader, this video is for you. Identifying system-wide challenges. Rising healthcare needs in communities. In many communities, particularly marginalized ones, there is a surge in health issues. This includes chronic diseases such as diabetes and hypertension, mental health disorders, and substance use problems. These conditions create an ever-growing demand for services, yet community health organizations often operate with fixed or declining budgets. This mismatch between need and resources results in longer wait times and rushed care, straining the organization's ability to deliver quality services. With limited resources, organizations may not be able to accommodate everyone who needs care. This could lead to longer wait times for services and even service denial for some individuals, worsening health disparities. Over time, this reduces the organization's credibility and ability to meet its mission of serving vulnerable communities. Limited resources to meet demand. The rise in demand puts an enormous strain on available resources. Many organizations face shortages in staff, limited training, outdated equipment, and a lack of essential medical supplies. This scarcity can affect patient care and worker efficiency. For instance, if there aren't enough staff members to manage the patient load, workers may become overburdened and experience burnout. Burnout and high turnover rates among staff are critical threats. When experienced professionals leave, it can be difficult to maintain program quality and continuity. This not only affects day-to-day operations, but also makes it harder to retain new talent, leading to a cycle of understaffing and reduced care quality. Inefficiencies in administration. Outdated processes leading to wasted resources. Pain points. Administrative inefficiencies are common in community health organizations, especially those relying on manual processes. Examples include manual data entry, outdated filing systems, and fragmented reporting methods that consume valuable staff time. These inefficiencies lead to duplicated efforts, more time spent on basic tasks, and an increased risk of errors. For instance, compiling reports manually can delay essential funding applications or progress updates for stakeholders. Threats to impact. The more time spent on administrative tasks, the less time staff have for patient care. This reduces the overall capacity of the organization to serve clients effectively and impacts the timeliness of reports to potential funders. Delayed or inaccurate reporting can result in missed funding opportunities, jeopardizing the organization's financial stability. Lack of staff engagement and retention issues. Pain points. When staff feel overworked or face inefficiencies in their roles, their engagement levels drop. This often leads to dissatisfaction and a high turnover rate. Without a supportive and well-managed work environment, staff members may feel undervalued and consider leaving for positions where they are better supported and compensated. Threats to survival. High turnover creates significant gaps in expertise and disrupts the continuity of services. It takes time and resources to train new staff, and losing experienced team members can diminish the quality of care provided. Over time, a reputation for high turnover can affect an organization's ability to attract new talent, further deepening staffing challenges. Staff retention and competitive salaries. Challenges in attracting and retaining talent. Community health organizations often struggle to match the salaries and benefits offered by private sector employers. This disparity makes it hard to attract and retain skilled professionals, especially when workloads in community settings are typically more demanding. High workloads, combined with insufficient financial compensation, can push staff to seek better paying and less stressful jobs. Losing skilled professionals can severely impact the quality and reach of programs. It also creates a knowledge gap that takes time to fill, affecting the organization's operational efficiency and service delivery. Potential hires may be deterred by the high turnover and reputation for staff dissatisfaction, creating a cycle of instability. Importance of employee satisfaction and support. Beyond salary, employee satisfaction is significantly impacted by work culture and support systems. If staff do not feel valued or supported, their commitment to the organization's mission will weaken. Additionally, a lack of professional development opportunities can hinder motivation and growth. Poor morale among staff can lead to a decrease in productivity and service quality. Engaging staff through continuous training, recognizing their hard work, and offering non-monetary benefits can boost morale and retention. Trust in community organizations. Building and maintaining community trust. Pain points. Trust is hard to earn and easy to lose, especially in communities with a history of neglect. Building trust requires consistency, transparency, and genuine engagement. Negative past experiences with healthcare systems can make community members hesitant to seek help, impacting service reach and effectiveness. Threats to impact. Without trust, people are less likely to use the services offered, reducing the organization's ability to impact community health positively. Lack of trust can also affect new initiatives, making it difficult to get community buy-in and participation. Impact of dwindling services on community relationships. Pain points. When funding cuts force organizations to reduce or eliminate services, it can breed discontent and erode trust. Communities may feel abandoned or believe that their needs are no longer being prioritized. Threats to survival. Reduced services can lead to decreased community engagement and reduced utilization. This, in turn, can impact future funding, as funders often look at community engagement metrics when making decisions. Economic factors. Broader economic downturns affecting funding availability. Economic recessions or slowdowns can create ripple effects that significantly impact funding for community health organizations. Budget cuts at local, state, and federal levels can reduce the pool of available grants and subsidies that these organizations rely on. This tightening of resources puts immense pressure on program leaders to maintain service levels with shrinking financial support. Private funding sources, such as donations from local businesses or philanthropies, may also diminish during economic challenges as donors become more cautious with their spending. This leads to decreased sponsorships, fewer community partnerships, and a significant reduction in available funds. Scaling back essential programs. Without adequate funding, organizations may need to cut back or eliminate programs that are vital to the health and well-being of the community. This can include services related to maternal health, mental health support, preventive care, or substance abuse treatment. The result is that communities, especially those already vulnerable, experience greater health disparities as access to care becomes even more limited. Organizational instability. Financial strain can lead to difficult decisions about staffing, such as layoffs or hiring freezes, which further disrupt service delivery. Additionally, as programs are scaled back or discontinued, the organization risks losing credibility and trust within the community and among potential funders. Increased pressure on staff. With fewer resources, remaining staff may have to take on additional responsibilities to keep essential programs running, leading to burnout, decreased morale, and higher turnover rates. Competition for resources among organizations. In an environment where economic uncertainty is widespread, competition for funding becomes fierce. Community health organizations must compete with larger, more established nonprofits and hospitals that often have dedicated grant writing teams and long-standing relationships with funders. This creates an environment where smaller organizations struggle to differentiate themselves and showcase their unique value propositions. Limited funding opportunities mean that organizations may have to spend more resources on marketing and advocacy to make their case for why they deserve support. This added layer of competition can be draining on both financial and human resources. Fragmentation of services. Increased competition can lead to a splintering effect, where organizations prioritize niche programs or services to stand out. While this may work for some, it can lead to a lack of comprehensive care in the community, as no single organization is able to offer the full range of services needed. Innovation pressure. To attract funders, organizations may feel compelled to create innovative programs or approaches. While innovation is generally positive, doing so at an unsustainable pace can spread resources thin and result in failed implementations or programs that don't fully meet community needs. Reduced collaboration. The pressure to compete for limited funding can hinder partnerships and collaborations between community organizations. Instead of working together to address shared challenges, organizations may focus on competing for the same resources, which ultimately weakens the overall community support network. While funding challenges are significant, community health organizations can survive and thrive by being proactive, improving internal processes, and staying connected with their communities. Remember, the goal is not just survival, but sustaining impactful programs and services for those who need them most. I hope today's discussion was helpful. Don't forget to like, subscribe, and stay tuned for more discussion about funding strategies and techniques for getting more funding.